Hello, everyone. I'm going to be talking about, and this is for the second week of our Pathofarm class, I'm going to be talking about hypersensitivities and autoimmunity disorders. We have a lot to cover this week on inflammation, infection, and hypersensitivities, which can all tie into each other. It's what makes it autoimmune versus just our immune system. So we will be talking about all of that. I will be talking about inflammation in great detail. It is basically the basis for a lot of disease and a lot of helping us recognize that there's a problem in the body and in cancers too. And I'll also be talking about infection along those lines of inflammation. And so we're going to start with hypersensitivities. And here are your objectives. And just a couple definitions here. Obviously, an allergy is an exaggerated response. It's a response that we don't really want to see against an antigen in the environment. And it can be a cat, hay fever. It can proceed to anaphylaxis or shellfish, milk, nuts, medication. It goes on and on about most of us know what an allergy is, but do we know that it is classified as an exaggerated response against whatever that is in the environment that our body is not responding to well is called an antigen. And there it is. Allergens equals antigens that cause an allergic reaction. Or I'm going to use allergic reaction and hypersensitivity are synonymous here. Autoimmune is immune against the host's own cells. And the biggest example I can give, the SLE, is systemic lupus erythematosus. It is the most common autoimmune disease there is, and it is one of the most severe. So it's just a response against the person's own body. Alloimmunity is directed against foreign tissues, and so that would be like a transplant rejection, something like that. And then immune deficiency just means the immune system can't protect the host or itself. It can't protect itself because it's immune deficient. And we're going to, again, talk about what are those specific cells. Okay, so some key points on hypersensitivity is an excessive reaction to an antigen. We already said that in response to re-exposure to the same antigen causes disease or damage to the host. So it has to be in response to something that has already had come into the body. Again, it's in response to a re-exposure of that same antigen. The first time it comes in, the body says, wait a minute, I don't want to recognize this. The second time is when you can have a huge response to it. All hypersensitivity reactions require exposure to an initial antigen. I basically just said that. And symptoms appear after an adequate secondary immune response and are either an allergy, an autoimmunity, like why is the body not protecting itself, or an alloimmunity type reactions. And then the disorder classifications go type 1 through type 4. And the four of these are interrelated, and a lot of hypersensitivity reactions or allergic reactions, several of these work at the same time or sequentially. So let's look at them. Type 1 is antigen specific. Most of our common allergic reactions are what we call IgE mediated. This is where we see anaphylaxis. It's the most potent mediator of IgE mediated hypersensitivity is histamine. That's what makes us have these IgE responses. We know that histamine does what? What does histamine do? Well, it constricts bronchial tissue. And in constricting bronchial tissue, right above the lungs, are we not going to become short of breath? It's going to impair our airway. That is how people go into anaphylaxis where we can't breathe. The most common food allergy, believe it or not, is shellfish. I thought at one time it might be nuts and peanuts because of what we hear about it, but no, they say the most common is shellfish. The allergen can be drug or food, and some of them we can name are chocolate, milk, so dairy, peanuts, eggs, again, dairy, citrus fruit, wheat, nuts, and I'm sure you guys can come up with wool, a ton of other ones. So that's what type 1 is. It's antigen specific. So we have an antigen that goes crazy in the body in response to an antibody that it doesn't like. Or an antigen, I'm sorry, that the antibodies are formed because of the antigen that it does not care for. It just does not going to mix with the body. A type 2 is tissue specific in the body. So it's cytotoxic, meaning it's going to hurt the cells of a specific tissue. Platelets, for example. Platelets are our blood clotters in our blood system, and they have groups of antigens that are found on no other cells in the body but the platelets. Specific antigens for the platelets. The symptoms of many of our type 2 diseases are determined by which tissue or organ expresses the particular antigen, and it can express itself through one of the types of platelets I was talking about. Type 3 are caused by an antigen-antibody immune complexes that are formed in the circulation and deposited later in vessel walls or other tissue. The primary difference between 2 and type 3 mechanisms is that type 2 hypersensitivity, the antibody binds to a soluble antigen that was released into the blood or body fluids, and the complex is then deposited into the tissues. Type 3 reactions are no organ specific at all. They block circulation. And type 4 is very interesting. Whereas type 1, 2, and 3, all the hypersensitive reactions are mediated by an antibody. Type 4 reactions are not. It's not the typical antibody-antigen response. Type 4 is different. It's mediated by our T lymphocytes and do not involve an antibody. Type 4. Type 4 mechanisms occur through either, again, the T lymphocytes and do not involve an antibody, or the cytokine producing Th1 cells. The T cells attack and destroy cellular targets directly. The Th1 cells produce cytokines that recruit and activate phagocytic cells. Now we know those are the ones that crunch and eat up everything, especially macrophages, which are large white cells. And cytokines, just to give you a refresher here, are signaling molecules that aid in cell-to-cell communication. So it interferes with this, with our type 2, because again, it's either the T lymphocytes or the Th1 cytokines it's interfering with. An example of type 4 are graft rejection, such as a burn, something like that, skin tests for TB, an allergic reaction resulting from contact with poison ivy and metals. A type 4 component may be present in many autoimmune diseases. For example, T cells against a type 2 collagen contribute to the destruction of joints in rheumatoid arthritis. And yes, rheumatoid arthritis is autoimmune. I'll say that again. The T cells against a type 2 collagen contribute to the destruction of joints in rheumatoid arthritis because these T cells malfunction and they go after that collagen that supports the joints in that disease. T cells against a thyroid cell surface antigen contribute to the destruction of the thyroid in autoimmune thyroiditis. So it destroys the thyroid. T cells against an antigen on the surface of pancreatic beta cells are responsible for beta cell destruction in insulin-dependent diabetes type 1. Yeah, diabetes type 1 is the one with destruction of the beta cells is considered autoimmune. We know that type 4 mechanisms occur either through the T lymphocyte or cytokine producing Th1 cells. I think I just said that. That's what I wanted to say. Th1 cells activate phagocytic cells, especially macrophages, so they can directly attach the red blood cell or attack the red blood cell, producing anemia, the white blood cell, which is going to produce leukopenia, lack of white cells. We're going to get infections easy. Lymphocytes, lymphopenia, and thrombocytes, thrombocytopenia. And we have lack of those, we're going to bleed. And elevated ESR, which we'll talk about later. And that's sedimentation rate, and that has to do with inflammation. So that's all wacky with type 4. Type 4 is very, very involved, and we'll be talking about that as we continue to go. So here, now to break it down a little bit more, other than what I just told you, type 1 hypersensitivity is mediated by our reactor of IgE, Immediate response to the second exposure of the antigen. On the first exposure, those antibodies, the IgE antibodies, are formed, and they bind to the surface of the mast cells. On the second exposure, the IgE antibodies on the mast cells cause degranulation, releasing histamine, and we know what histamine does. It's responsible for causing a lot of the allergic reactions. It causes vasodilation and bronchoconstriction. Do not get this mixed up. A lot of students think it's vasoconstriction and bronchoconstriction. No, it's vasodilation, so it's letting a lot of fluid out in a space it's not supposed to, dilating those blood vessels, but it's constricting where we breathe. Genetic predisposition to develop allergies can happen here. If one parent has an allergy, there's a 40% chance a child will develop, 80% if both parents have the allergy. So my mother was allergic to a lot of antibiotics, and I'm allergic to penicillin and sulfa and now macrodantin and erythromycin, which I took for years. So I'm ridiculous when it comes to antibiotics. I also have, my son is allergic to only sulfa, and my youngest daughter is allergic to everything I'm allergic to. So, but then I have one daughter who's allergic to nothing. So there you go. The most common irritating hypersensitivity type 1 would be rhinitis, which is like sneezing and coughing. It's like a runny nose. And that would be during times of high pollen, like when spring has just sprung. Okay, type 2 hypersensitivities are IgM and IgG. Antigens are on surfaces of target cells, and other antigen antibody binding cells are damaged. The damage can occur in 5 ways, including phagocytosis by macrophages, lysis, which is just breaking of all cells, or cell-mediated cytotoxicity, toxic products by neutrophils. So again, this one is the one that we talked about that is tissue specific. Examples, drugs can bind to specific cells, usually platelets or red blood cells, and become targets of type 2 reactions, such as hemolytic anemia. And again, this is cytotoxic. It's going to kill the cells of a specific tissue. And that's why the example here is it's attacking maybe just platelets and red blood cells, but not white cells or lymphocytes, and become targets of type 2 reactions such as anemia, hemolytic anemia. Okay, I'm going to stop right here, and then we'll move on with the second part with the next video.